Welcome back. This is the second video for the fourth class of social psychological perspectives on health. So in the first video, we covered chapter 2. We finally finished chapter 2. And then in this video, we will cover chapter 3. So the chapter 3 is on social status and disadvantage. So we will look how social status is related to our health. Okay, so in sociological study, there is a famous phenomenon that called, that is called health gradient. So in this chapter, we will talk about social status, and social status can be called differently or can be measured differently, such like social status, social rank, social class, and socioeconomic status, or in short, SES. And then these social status can be measured by income, wealth, education, living conditions, skills, gender, ethnicity, geographical location, or social standing more generally. But in short, in this chapter, we call them as social status. And then previous research has shown that these social status, these differences in social status affect access to resources, education, housing, quality of employment, and the extent to which they can exert power and social influence over others. So in short, social status affects health and well-being and even mortality. So this is the graph created based on the research in Australia. So the health gradient in Australia. So you can see that, hold on. Okay, so here, these people are in the highest social status in society. And these people in the lowest social status in the society. And blue line indicates men, and then orange bar, it's not really line, but more like a bar. Orange bars indicate women. And on the y-axis, it shows the deaths per 100,000 population. And as you can see, from the lowest to the highest, the percentage of death in the population decreases. And then the graduation is more apparent among men than women, but still there is a gradient from the lowest social status to the highest social status. So if you link the top of each bar, you can kind of see that oops, sorry. Yeah, you can see that there is a slope from going from the left going down to the right, okay? And also the research indicates that the richest 20% live 6 years longer than the poorest 20%. So it means that the more people have money, they can actually live longer. And then the simplest explanation for this phenomenon is that, the richest or the rich people have more access to resources, education, housing, quality of employment, and the extent to which they can exert power and social influence over others. But, for example, maybe people think that, well, some richest people have more money to see doctors or have more knowledge in terms of what kind of behavior should help them to be healthy, to stay healthy. But what this phenomenon, what's interesting about this phenomenon is that even if people have enough money and knowledge to cover their medical fees, still, even among the rich people, you can still find that there is a health gradient. For example, if you look at the social class, the highest social class 5 and the second highest social class 4, you still find a difference between the these classes. Even if they have enough money, even if they have enough knowledge, still there is a difference between social status groups. And then we try to understand why there is such differences. Okay. So before we try to understand this phenomenon through the eyes of a social identity approach, let's see how physiological models say about this. So in this model, we use animal studies to understand the impact of social status on health. So animal studies indicate that low status evokes a strong biological stress response. And when such stress is chronically high, it would compromise health. And then the way such stress compromises health is that there would be immune suppression. Excuse me. So there would be immune suppression, loss of muscle mass, and reproductive suppression. Okay. And also some studies show that when exposed to a live snake, dominant male squirrel monkeys showed greater and more rapid response. So such stressor triggers escaping behavior, and then it would help them to remove stressful situations faster. However, subordinate male monkeys showed a more sluggish or slow physical response. In the way, they cannot escape from stressor and thus experience more stress. So these studies show that dominant monkeys can quickly remove their stresses, and thus they would have better well-being compared to subordinates who cannot make a quick response, and thus they have to endure stressful situations longer. And then this kind of difference actually creates overall health condition on these two groups. And then this kind of difference can be summarized as following that the low status people, or I mean low status animals or monkeys, is related to just low status, low social status is related to low predictability and lack of control. So subordinate monkeys cannot predict what would happen because they do have less power over the situations, and then they do not have much control in terms of how they can manage their situations or how they can control their situations. But social context matters. So this is not just about physiological model, but there is some social context that that has a room to influence on this association between social class and stress and even health. So when the hierarchy is unstable, because ranks within a group change regularly. So meaning that high status or dominant animals may lose their status because the ranks within the group change regularly. So some high status animals may go down in terms of their status, and other middle rank or low rank animals may climb up the stairs of the status. So in such situation, high status or dominant animals experience higher stress due to unpredictability of their own status. So because in this group, because the ranks change regularly, especially high status animals experience unpredictability of their own status in the group. So they always need to be cautious about protecting their high status, right? But I wrote here, is it true? Is it really true? Because in the textbook, the Hazram cited the study by Gust here, Gust 1991. And then I looked up the original article, and in the article, the authors actually argue that subordinate animals, subordinate monkeys experience more stress after being in a new situation or being in a not so much about in a new situation, but basically these 8 or 9 monkeys were put together in some area that they need to live together. And then in a new situation, as time spends, those animals will get their status. Like some animals become high status in that new group, and then some other animals, some other monkeys will get lower status in that group, right? And here, according to the authors of the original text, they argue that the low status animals, monkeys, experience higher stress than dominant monkeys. And they base such argument on this data. So here it shows a CD4 positive T cell change. Okay, so basically this cell indicates how much their immune system is working. So when these cell, when the amount of these or the number of these cell is decreasing, it means that their immune system is not working. As you can see, low dominant group, like here, orange bars, show the decrease in the number of CD4 positive T cell. So this indicates that the immune system is not working. And if you look at Bluebird, they actually, okay, so the 0 means that the number of T cell, CD4 positive T cell, when they enter, before they enter this new condition, new living area. So it means that 0 indicates the number of CD4 positive T cell when they feel comfortable. But once they enter the new condition, new living condition, both dominant and subordinates experience the decrease in the immune system. But as you can see, dominant animals experience less decrease in the immune system. And then as the time goes by, subordinates goes back to the original level of CD4 plus positive T cell. And dominant actually increased the number of CD4 positive T cell. So by these changes, I guess the authors of the original article argued that subordinate monkeys experienced more stress than the dominant monkeys. But as you have seen in the textbook, Haslams and others argued that dominant animals actually experienced more stress. And then this is my interpretation, and it may not be true or may be true. But according to the research, like biological research, the decrease of CD4 positive T cell is not good for our health because it means that our immune system is not working. But increase in the number of CD4 positive T cell is also not good for our health because it means that our immune system is working too much. So when this cell increases too much, it will attack our body, even the part of health, even the health part of our body. So maybe the authors of the textbook was referring to the immune overreaction. So although after 9 weeks, it has been 9 weeks since these monkeys came to the new living conditions, dominant monkeys still can see that their T cell is increasing compared to when they used to be comfortable. So maybe they should be experiencing immune overreaction, while subordinates, yes, they initially had a decrease in the immune system, but after 9 weeks, their immune system is functioning just fine. So maybe this is the difference, or this is why the interpretation of data is different. So the original paper was published in 1991, and I think by this time, the too much of CD4 positive T cell is also, by this time, they should have known that CD4 positive T cell, too many of CD4 positive T cell is not also good for our body, but I'm not sure. So I guess the lesson we can get from here is that it's always important to go back to the original resource. You do not just get it for granted. Okay, anyway. And also, I think it's important to note that this is not the only study. This is the study done by Gusto in 1991. It's not the only study. There are other studies. And a study with various primates living in captivity, subordinates showed higher stress response than dominants when they did not have opportunity for social support. So the figure A, upper panel here, this indicates a relative cortisol level. So relative means that the relative to the dominant. This is a subordinate level of cortisol, and then by saying relative, it means relative to the dominant monkeys. And then cortisol is an indicator of stress experience. So when that is higher, it means that they experience more stress. And then, so basically, as you can see, the x-axis indicates the level of stress they are experiencing. So the more stress they have, they would experience more stress. I mean, the more stressors they have, the more stress they are experiencing, okay? And the lower panel here, panel B indicates on the y-axis relative cortisol level, and on the x-axis degree to which social support is available for subordinates. Although the pattern is not so clear, but you can still see that the more subordinates have social support, their relative cortisol level is lower or smaller. So, for example, when they have two social support, again, the pattern is not so clear, but for example, if you look at number 1, this means that each number refers to the different animal, different monkey species, different species of monkeys. And if you look at number 1, when they have 2 degrees of social support, like grooming or eye contact with other animals, other monkeys, then their relative cortisol level is like 40%, meaning that the levels of stress their subordinates are experiencing is 40% less than the dominants. And then also there is, if you look at number 6, even though they are subordinates in the group, the level of experience is as high as the dominant animals. So this indicates that social support actually help them to reduce the amount of stress that they would have been experiencing as subordinates. And then look at the zero degree of social support. When they do not have social support whatsoever, then their level of stress is 140% more than the dominant. So although as I am saying, the pattern may not be so clear, but still, if you or if monkeys have social support, then the level of the level of stress they experience is less or as much as dominance would experience. Okay, so improving one's status is not the only way to improve health. So even if you are in the lower social status in the group, if you can develop social solidarity, feeling connected and united with one another, then you can improve your health. Okay, so in the next class, we will look into more about what kind of studies we can learn using human participants. Like what we can, in the next class, we will learn studies using human participants, and then we will learn how social status affects our health. Okay, thank you very much. That's it for the fourth class. Thank you.